Why does jaundice cause intense itching? Imagine your skin suddenly feels like it's crawling with tiny pins or feels unbearably itchy. That's often what people with jaundice experience, and it's more than just a skin irritation. Jaundice causes this intense itching mainly because of substances that build up in the body when the liver isn't working properly. When the liver is damaged or blocked, it can't process bilirubin, a yellow pigment that normally gets excreted through bile. As a result, bilirubin and other substances like bile salts start accumulating in the blood and tissues, leading to the yellowing of the skin and eyes, which is the hallmark of jaundice. But why does this buildup cause itching? Recent scientific research shows that bilirubin itself can activate specific receptors on nerve cells responsible for sensing itch. These receptors are called MAS-related G protein-coupled receptors, or MRGPRs. When bilirubin binds to these receptors, it directly excites the nerve cells, sending signals to the brain that are interpreted as an intense itch. This discovery suggests that bilirubin isn't just a marker of liver problems, but may actively cause the itching sensation. In addition to bilirubin, other substances like bile acids and pruritogens, molecules that trigger itching, also play a role. When bile flow is blocked, as in cholestasis, these substances build up in the bloodstream and tissues. Normally, the liver would excrete these into bile for elimination, but when bile flow is impaired, they accumulate and stimulate itch receptors on nerve endings in the skin. This is why people with bile duct obstructions or severe liver disease often experience intense itching. The central nervous system also contributes to this sensation. Imaging studies have shown that the brain's limbic system, which processes emotions and sensations, is involved in perceiving itch in cases of cholestasis. This means that the feeling of itch isn't only caused by substances on the skin but also involves brain pathways that amplify or modulate the sensation, making it even more uncomfortable. Other molecules like lysophosphatidic acid, endogenous opioids, serotonin, and steroids have also been linked to jaundice-related itching. These substances may interact with nerve pathways or influence how we perceive itch, although scientists are still working to understand their exact roles. In the context of liver health and liver cancer, jaundice and the associated itching are important signs that something isn't functioning right. Liver cancer can cause liver tissue damage or block bile ducts, leading to jaundice. The intense itching can significantly affect a person's quality of life and may indicate worsening liver function or bile flow problems. Treatments aim to relieving the symptoms and address the underlying cause. Doctors often prescribe medications like bile acid binders, such as cholestyramine, or other drugs like rifampicin, opioid antagonists, and serotonin reuptake inhibitors to help reduce the itching. Sometimes, procedures to drain bile can help remove the pruritogens and ease symptoms. To sum up, jaundice causes intense itching because of the buildup of bilirubin and other substances that activate itch receptors on nerve cells and involve brain pathways. This symptom reflects underlying liver problems or bile flow issues, which are common in liver diseases including liver cancer. If you or someone you know experiences these symptoms, it's important to consult a healthcare professional for proper diagnosis and treatment.